Before I begin, I'd just really like to thank Bob for the invitation to come and speak with you all today. Hopefully I will give you a little bit of information on what the research says and how that translates to you engaging in physical activity, incorporating it into your daily lifestyle. As I was leaving my house today, I've got a 6-year-old, a 4-year-old, and an 18-month-old, and my husband looked at me and I've got a little white outfit on, and he said, "What, are you dressing up for the theme?" And then my 4-year-old pipes up with, "Nice costume, Mom." Until they don't see me dressed up very often. Oops, that's not the right one. There we go. So I thought, in keeping with the theme though, I would start with the man himself, and actually the quote below from his partner in crime, Olivia Newton-John, about her cancer experience, and the positive, really, that she's taken out of it. So here's a couple of famous faces. You're going to see kind of a theme over these. So this first one is U.S. Olympic swimmer Eric Chanteau, who's off to Beijing this week. There's Josh Bidwell, if anybody's a football fan. A little baseball. What would we be in Canada without our hockey? An amazing athlete, obviously, an amazing cancer survivor. The guy we're all probably most familiar with, of course, Lance Armstrong. Golfer. We've got another golfer coming up later in the show who's a prostate cancer survivor. Anybody know who that is? Amy Palmer, that's right. So what can we learn from all these famous faces? Hopefully the commonalities there, the benefits of a physically active lifestyle. But first, what's the potential negative impact? I do education sessions here in town at the Prostate Cancer Institute, and this spring there was a big thing in the paper on university research at Duke University on some mice-based research, which basically showed that mice who were more active on those little treadmills they threw into their cages showed an increase in a prostate tumor growth. So when I walked into the session, all the guys said, "Okay, wait a second, should we not be exercising if it's going to make our tumor grow faster?" So I happened to know a couple of the researchers fairly well and gave them a call and said, "What's your take on this?" And they really noted two things. Number one, it's a mice model that they're working from, so very different, obviously, from a human body. Second big thing is that these mice were not receiving any sort of treatment. So they were just injected with the carcinogen to grow the tumor, given access or not to an exercise wheel in their little cage, and no treatment was done to try to stem the growth of the tumor. Okay, so those are really the two big differences, and my colleague said basically the bottom line at this point is that physical activity is good for prostate cancer survivors. They're just at the front end of it, and they're going to be looking at, well, can we use this exercise maybe as a means to help transport the treatment to the tumor site more effectively? So that's where that research is going. But in no way does he say, oh yeah, stop being physically active. There's just too many benefits right now that far outweigh any potential negative impact. And as you'll see from the talk today, all of the research today clearly shows benefits. So this is what I want to do today, talk about the research, just kind of on a high level, and what does it mean really? Let's translate it to what does it mean for you on a daily basis for prostate cancer survivors, and what can you do to help integrate it? So I've got just a little clip here. This isn't prostate cancer specific, but it'll give you an idea of some of the research that's going on.
When Sandy Reynolds was told she had breast cancer, she could hardly believe it. Sandy has always been active and healthy, and in her family, cancer was never a concern.
My grandma didn't have it, my mom didn't have it, and my sister didn't have it, and I'm the youngest. and it never ran in none of, like my dad's side either.
She knew battling cancer would be tough, but Sandy and thousands of women like her might have assumed that because she was in good shape before she was diagnosed, it might help after she was treated. But a study in the Journal of Cancer Survivorship says that's not the case.
Counter to what we expected, the amount and type of activity that they were doing before diagnosis didn't really matter all that much.
Catherine Alfano is a researcher at Ohio State University's Comprehensive Cancer Center. She found that no matter how fit a woman might be at the time of diagnosis, symptoms like pain, fatigue, and depression can strike any woman at any time. But here's the good news. Following more than 500 breast cancer patients, Alfano found that those who worked out after they were diagnosed were healthier and happier day to day, and the benefits may not stop there.
Physical activity is not only good for symptom management, it actually might result in lower risk of recurrence, lower risk of second cancers, and these are things that breast cancer survivors worry about every day.
It's something Sandy worries about, but she's taking steps to keep fit, hoping it will keep her symptoms and her cancer in check. At Ohio State University's Comprehensive Cancer Center, this is Clark Powell reporting.
Okay, so why did I show you that? It is breast cancer. I'm talking to prostate cancer. Whoops. But I think the message is the same, and it's really, yeah, people can be coming into cancer have been physically active their entire lives or not at all. The research is showing it's what you're doing after that's really going to have an impact both on the symptom management, which is fairly consistent across types of cancers in terms of the fatigue, depression, anxiety, loss in physical functioning, but also the latest research is really showing that physical activity may play a really significant role in improving long-term chances of recurrence. So right now, this is what we know. This is some of the research that's just come out in 2008. The bad news first, activity levels are generally very low in Canadian cancer survivors, with less than 22% reporting that they are active enough to receive health benefits. However, if we look across the research, we know that exercise is both safe and tolerated at all stages of the cancer experience, and that there are consistently positive findings for both the physiological and the psychosocial benefits. So this area of research has really exploded in the past 10 or so years. We have more than 20 reviews of the literature to date, which include more than 100 studies. Now, consistent with the video that you just saw, the vast majority of the research is with breast cancer survivors. That's kind of where it all started. If you look up there, is this going to work? Can't see it. Oh well. There's 32 breast in terms of, if we're looking at actual interventions, and only 6 studies to date that have been physical activity interventions for prostate cancer survivors. So a relatively small number. Research has, though, looked at both on-treatment and off-treatment across these different cancer types. And as I said, the research is really moving from the physiological perspective to understanding how physical activity can diminish rates of recurrence and improve actual survival. So they're taking a look at what's happening at a cellular level and how that translates into long-term survival. From a psychosocial perspective, the overall focus is really on how physical activity can improve quality of life. That's the QOL there at the bottom. So in general, if we look at the cancer, not prostate specific, but what we see is that there's symptom relief. So the research that is on treatment shows improvements in nausea, improvements in sleeping disturbances, and the resulting improvements in reduction of fatigue. From a fitness perspective, the changes we see are tied to the type of intervention that's done. So if it's a cardiovascular-based intervention, we see changes in aerobic capacity and in functional capacity. If it's a strength-based intervention, you'll see the changes in strength measures, sometimes in flexibility. Overall, when it's on treatment, a lot of the research has looked at changes in body composition. We know a lot of the treatments, especially hormone-type treatments, are associated with increased body fat and decreased bone mineral density. We know for that population, if they're working out while they're receiving the hormone treatments, that you can actually diminish the increase in body fat and increase the bone mineral density, which is so crucial to bone health. I believe tomorrow you've got a talk on the osteoporosis linked to prostate cancer. So the physical activity research is actually looking at that as well, along with the nutrition focus. And again, from the physiological indices, it's really moving to how we can impact actual recurrence and survival. The two big things that are being looking at are the natural killer cell activity and how that changes with physical activity, regular physical activity, as well as improvements in the immune response, so making people healthier overall so they're less susceptible to issues in terms of physiological response. So what does it mean for prostate cancers? There's kind of been two groups looked at, those on ADT and those receiving radiation therapy. The latest review that just came out really highlighted that strength training may reverse many of the adverse effects during and following androgen deprivation therapy. So what we know that is associated with androgen deprivation therapy is we have a loss of bone mass, we have reduced muscle mass, and reduced strength. These have implications for physical functioning, which translates into implications for daily functioning. So if an individual has lost his muscle mass, may not be as easy for him to engage in those things of daily living that he's used to be doing. May feel more fatigued while he's doing it, and eventually withdraws from doing those activities, which continues the cycle of disuse. So they lose muscle mass, they stop doing what they used to be doing, lose more muscle mass, withdraw, and aren't engaging in those things that were once probably very important to them. We also know in ADT that men experience increased body weight, and with that it's an increase in fat mass. It's not an increase in lean muscle. There's an increased risk of depression, and there's also the increased fatigue, which we know can be reduced with those gentlemen who are able to engage in physical activity. And it's the strength training that has really been shown. So I'm going to highlight a couple of studies in a few minutes. So in general, if we look across, as I said, there's been 6 interventions, and then there's been another probably 14, 15 studies that have just been cohort questionnaire type of studies. So they've asked men, what are you doing in terms of physical activity? And they just look at associations. So pulling from all the literature, what we know is that the more active versus the less active group have better sleep patterns, reduced anxiety, enhanced abilities to perform activities of daily living, so they're maintaining their functional independence. We see from a physiological perspective that it can boost the immune system. There have been 2 studies that have looked at oxygen transport in the body, and we see that there's better oxygen transport to the brain and to the tissues for the most active versus less active groups. Increased flexibility and range of motion. This has come out of a couple of the studies that have actually included that as a component of their intervention. So I see it all the time, and then when they ask me, okay, if I choose one thing, what should I do? My first answer is start doing some flexibility training. Everybody thinks, oh yeah, I'm going to tell you to go hit the gym or whatever else. Do some stretches. It's the #1 thing that you'll see the fastest change in, and it is probably the most important predictor of maintaining functional ability. So if you're going to do anything, start stretching. And then, of course, depending on the type of activity, maintenance, or regaining, that's a big one, is that clip just showed you, it's not necessarily what you did before, it's what you're doing after. So you can regain muscular fitness and can improve and regain your cardiovascular system. Now, across the literature, again, this isn't prostate cancer specific, but as I said, quality of life has really been the big focus of all the physical activity research. And the 2 dimensions that have been most associated with physical activity are obviously someone's physical quality of life, and related to that, integrally tied to that, is their functional quality of life. Because if they're physically able to do something, then they can engage in the daily functions that are deemed important to them. From a psychosocial perspective, we see the triad there, the diminished depression, anxiety, and emotional distress. And then the enhancement of all the selves, the self-esteem, the self-efficacy, social support, and satisfaction with overall life, or quality of life. So again, pulling from the 6 interventions and the 14 or so studies that have looked at prostate specifically, the big one that really comes out is the enhanced social support that men report from engaging in physical activity. So a number of the interventions have been group-based, and consistently across it, even if it wasn't one of the main focuses of the research, was this reporting of the social support that they got from that group environment. It's something I'm going to talk about our own research that myself, John Robinson here, and a couple of other colleagues are doing. And this has really been one of the important outcomes that's come from our own group-based research, is that these men connect with other men and report this enhanced social support. And as I'll tell you in a few minutes, social support is key for people maintaining a physical activity program. Again, we see the increased quality of life, the enhanced feelings of independence and self-confidence. This is something that when someone's diagnosed with cancer, the sense of control is kind of taken away from them. They may have come in being very healthy, and all of a sudden they're told, hey, you've done everything right, but you still have cancer. And we see this across the board, not just prostate, but all sorts, all the different types of cancer. And getting somebody to then engage in physical activity helps them to regain that sense of personal control over their life that maybe has been taken away to the cancer experience. And it increases their confidence in their ability to engage in the physical activity, and that translates then in their ability to engage in other important aspects of their life, things that they deem important. So I picked out just a couple of the most recent studies. Now these are across the board, not prostate cancer specific. But as you see here, there's a couple of commonalities across the studies. The number one reported treatment-associated outcome is fatigue across cancer survivors. And it has been the number one studied along with the quality of life. It's what's the relationship between fatigue and quality of life. And the most recent study, Crampon and Daniel, found significant improvements in fatigue both during and following therapy, and this was a physical activity intervention, aerobic-based, so a cardiovascular-based program. Schneider and al. Last year found in a strength-based program significant improvements in muscular endurance, and that in turn was associated with decreased depression and enhanced total quality of life. And again, this was both during and after treatment or therapy. Also included there are two meta-analyses. So these are researchers who have pulled together the studies and said, okay, what's the commonalities across a group of studies? And they found, Kahn et al. In 2006, that the most pronounced influence of physical activity was on physical function domain of quality of life, which makes sense. Physical activity is physical, so you're going to improve the physical functioning. They also found that there were significant across the study influences on the body composition, on fatigue, symptoms associated with treatment, mood, and again, that overall quality of life. Okay, so the research, Schmitz et al., same sort of thing, is that it is generally positive. There have been no studies which have all of a sudden come out and said, hold on a sec, here's a big drawback. Okay? Everything that has been reported, it's either been, yeah, it's maybe making a small to mild change, or it's making a moderate to large change, but it's all been on the positive spectrum. So to date, I'm not aware of any studies that have come up and said, just a sec, there's this big caveat here. Okay, so as I mentioned at the start, there have been 6 studies on prostate cancer that are interventions. 4 have been on men receiving androgen deprivation therapy. 2003 was the first one from Segal, and she was the first one who used a resistance exercise program. Basically because in men with prostate cancer, bone mineral density, when they're on ADT, is a big concern. And so she took a resistance program in the hopes that that would alleviate the decrease in bone mineral density. And what she ended up finding was that, yes, quality of life was significantly improved, primarily due to the association with the reductions in fatigue. And then muscular fitness was improved, which makes sense. It goes along with the type of intervention. It was a muscular program, a strength program, and that's what they changed in terms of fitness. So this was somewhat replicated by Oliver and colleagues. Again, resistance exercise, and the same sorts of things found improvements in body composition, fatigue, quality of life, as well as improvements that were related to the type of program, so the body strength and then the flexibility. And in their program, they did resistance, and they also taught them stretches to go along with each of the resistance exercises, and found, again, the significant changes in flexibility. So Galvao et al., again in 2006, was trying to take it that next step forward and really look at the musculoskeletal system and what actually was changing, and found, again, functional performance benefits. This one doesn't work. Does anybody see the red dot up there anywhere? Okay. It's not reaching that far. I see it on my hand. Again, found the improvements in muscular strength and endurance, the functional performance and balance improvements. So they were doing a lot of tasks that weren't gym-based tasks. They were functional tasks such as step tests, so getting people to go up and down stairs. They did things like going up and down stairs and pulling open a door. So really functional things that translated back into the individual's activities of daily living so that they could maintain their balance on an icy sidewalk when they're opening a door. But doing the same, at the same time, they're strengthening their leg muscles and strengthening their core muscles. So along with colleagues here in Calgary, we've, over the past few years, been running prostate-specific interventions. And we've tried to really take what Sigal did in the beginning with the resistance training, but take it out of a gym setting. And we moved to a home-based setting where we focused on the resistance exercises. And then they'd come in once a week where they would get the group-based support in that setting, as well as being able to do some more aerobic types of activities. We had a gym-type setting where they could walk around. And so in our home-based program, where we asked them to work out 3 to 5 times per week, we found improvements in their total amounts of physical activity levels. So people came in reporting, in general, less than 2 to 3 sessions per week, and that increased significantly to 4 to 6 sessions a week. So we were able, with the home-based program, to get people to actually do it. And then we saw the improvements in physical fitness, improvements in their resting heart rate, improvements in their rate of perceived exertion, so how hard they reported that they could work, improvements again in fatigue, and in their BMI, so their weight improvements. Now, the 2 other studies that have been done in the prostate-specific area have been with men undergoing radiotherapy, and both of these have been aerobic-based programs, so not doing strength in this population, and both have shown, again, positive benefits. So the home-based walking program showed improvements in their physical functioning, which translates into improvements in their overall quality of life. And then for the 2007 one, cardiovascular program, they actually see improvements in all of the indices of fitness. So the 3 indices of fitness are cardiovascular, strength, and flexibility. And as you can see there, they actually get, from a cardiovascular program, improvements. And the muscle strength improvements are what you would expect, that they're improvements in the strength in their lower limbs, which you would get from an aerobic-based program such as walking. They also report improvements in their overall quality of life, and again, the reductions in fatigue. Okay, so that in a nutshell, a very quick overview, is the research to date and what they're reporting in terms of the benefits. Now, how does this translate back into what should the prostate cancer survivor be doing? Well, the first thing is to educate. It's amazing how many people still come in and they aren't sure what they should be doing or if it's safe for them. Is it something they can do while they're on treatment? Do they have to wait till after? In general, what we know from the research is that we need to encourage activity from diagnosis through survival. Okay, so it used to be that physical activity researchers said, okay, there's a lot going on when someone's first diagnosed, let them get through treatment and then we'll see if we can get them into a program. In the last 3 years, there's been a real explosion of research getting people as soon as they're diagnosed and saying, okay, this is going to help you, it's going to help combat a lot of the symptoms that you feel going through treatment. And so the research has really started to say, okay, it's feasible, we know we can do it, it's not going to hurt them, and it's going to provide a number of benefits, so let's get them as close to diagnosis as possible. Now, the latest studies really show that increased activity levels, and this was taken from a number of the studies and reviewed, said that walking, for example, 30 minutes most days of the week, so this is a mild to moderate type of activity, it's not strenuous, may increase survival by 50% and significantly reduce recurrence rates. Okay, so I think a pretty powerful message. And the other big thing that's really come out from the education is the role that the physician has to play. Now, I know physicians are crammed in their time and they don't specifically have training necessarily in the physical activity, but we're really trying to work within the Cancer Center here in Calgary to let doctors know what we're doing from a research perspective, trials that are ongoing that patients can come into, and we're also working, we're starting with actually a pediatric group, but we're devising a web-based tool that physicians can use. So when a patient comes into their office, They can quickly put in their name, age, and a couple of characteristics, and out will come a physical activity prescription. So we're piloting that right now with pediatric oncologists, and hopefully it's going to move on to the other oncology groups, as we think it's really important. Survivors report to us all the time that the number one thing is if their physician has said, hey, you need to up your activity level, that's when they'll start doing it. That's when they'll come find us and say, hey, my physician said I should get in touch with you. Okay, so we want to try to work that angle and get them in to see us sooner versus later. So there's another little short clip here on some work that's, again, it's not prostate specific, but lets you know about the message that's getting out there.
Increasing the amount of physical activity that you do in a day is an excellent way to both promote more energy, feel good, and also help to promote cancer survivorship. Some exciting research has been published showing that activities such as walking can help reduce your risk of breast cancer and colon cancer from coming back if you're a cancer survivor. Physical activity is also another way of helping to promote a healthy adult weight. Moderate levels of activity, rather than super strenuous, vigorous levels or mild levels, are really the most effective way of getting the benefits of physical activity, such as improving your immune system's strength. So we want to encourage everyone to walk a little bit more often in your day. Even if you split that walking up over the course of your day, just getting more active is a great place to start.
So again, that's just the key message, is just starting to incorporate it into the day and starting as soon as possible. In terms of education, what we do here in Calgary, and just to show of hands, how many people are Calgary based in the room here? Okay, how many are Alberta based? Just got a few from Edmonton. And this is Edmonton or other centers? Edmonton?
Red Deer.
What was the other one?
Red Deer.
Red Deer, okay. Well, actually, I'm going to put up some contacts near the end, but we've got Edmonton-based contacts, and actually we've got a colleague in Medicine Hat and one in Red Deer as well. So we're going to start doing kind of programming that is hopefully going to reach beyond Calgary. Right now, we do sessions at the Prostate Cancer Institute, and as you can see from the brochure there, there's an exercise component, a nutrition component, pelvic floor rehab, and then the psychosocial patient and family counseling. So it's just about, again, letting individuals know what is available so that they're not left floundering, and if their doctor said, yes, you need to engage in more activity, they've got a place to go to start. And that's where we do it in Calgary, is through the PCI. So getting active, how much activity? As the doctor from Dana-Farber just said on the YouTube little video, it's not strenuous activity. It's about working it into your daily lifestyle so that you will continue to do it. The big key is not whether or not you have cancer or what stage you're at, it's what is your initial fitness level and overall health status coming in. Okay? The clip at the beginning indicated it's not, again, for the benefits, it's what you're doing after your diagnosis that matters. What you do depends on your health status. If you came in and you have been very fit and you've been walking or biking or golfing, whatever it is you choose to do, then that will dictate how much you should be doing on a regular basis or how much your body can tolerate going through treatment and then afterwards. Making the gradual changes are best. It's easy for me to say, yeah, for the maximum health benefits, you really try to get 30 minutes every day of the week. But if you're coming in being completely sedentary, I think the first week would just about knock you off. So you want to start gradually. You want to maybe start with 10 minutes a day, every other day. Okay? It's just about doing little bits and working it in so that you've got a regular physical activity lifestyle. Mild to moderate activity is more realistic for the majority, especially during treatment, but again, it depends on your initial health status. And working more into that moderate range, and then if you can, if it's comfortable, into higher levels of activity, post-treatment is probably more realistic for most of us. So just a quick show of hands, how many people in the room would consider themselves currently physically active to get health benefits? Ah, that's great. It's like preaching to the converted up here. Great, okay, so most of you look like you're probably already on the right track. But again, if you're looking for where you start slow and gentle and find what you like. Now, in terms of resources, the one that a lot of programs are still based on, in Canada at least, is Canada's Physical Activity Guide. If you go to the website, you can actually download the guide. Now, there's a guide for children, there's a guide for older adults, and there's a guide for adults. So you can kind of pick and choose where you need to be at. There's also some really good resources at both the Cancer Supportive Care Program website and the American Cancer Society. Now, there's tons of websites out there, and some are reputable and some are not. NCI, NCIC in Canada, the Lance Armstrong Foundation, these ones here, all really good resources. If you're stuck, I'm not sure what Bob's doing. If you have a website, we can put resources and stuff on after, so you don't have to copy any of this down. Yeah. So we can put it up there. I'll show you, I think I added our website at the end. So what we've tried to do through the University of Calgary, we've got a website associated with my lab. And on that, we've got links to all the websites we've found that have good, safe, reliable information on them. So you can just go to our website and then click on resources and everything kind of comes up for you, so you don't have to spend hours searching. Because you can spend hours searching. And now, if you're more like me and prefer to have the paper in front of you, instead of looking at a screen the whole time, this is a really great book. Anna Schwartz is a cancer survivor and a researcher. You can get this book at Chapters or any other bookstore, really. And it's really got a great take-home message in terms of how can you work physical activity into your daily lifestyle. So if you're struggling a bit and you want to know, okay, what is a way to get started, I highly recommend this book. It's evidence-based, but it provides nice exercise options, and it's realistic. So it's not saying, okay, you've got to be Lance Armstrong and start training and get out there right now. It's how do we work it into your lifestyle. So a really good resource. And there he is, Arnie Palmer. Still golfing today. One of the prostate-specific resources that we like to use is out of Seattle Cancer Care. And they've got examples of different exercise programs, basically. So the duration and frequency, how much should you be doing? And again, it has to be tailored to what's your fitness level coming in. But they've got some really nice programs, and I think on this one they've actually got links so you can see the exercises. They've got little videos, so if you're not sure how to work out with a ball and band at home, they've got links. Now, in terms of in Alberta, the University of Alberta and Dr. Kerry Kearney, he's probably the world leader in terms of physical activity and cancer research, and he's right here in our own province. He's a good colleague and mentor of mine on all the work I do, and we actually have a couple of shared grants together. He is purely research-based, so he is bringing people in, and right now he's taking that really physiological bend and saying, okay, how is this going to change recurrence and survival? What is happening in the body? So his research is really going on that end. But he does have a few that have kind of translated into community programming, and the one is the breast cancer exercise program. So there's actually a PDF there. Now I know it's breast cancer, but it is a walking program, so it can be easily something that men with prostate cancer could utilize as well. If walking's your thing, it's got a nice booklet on how you can track yourself over time and build up so that you're eventually achieving the health benefits that we know are important. And then there's the work that we're doing right here in Calgary. What we do is we're trying to do the research, build the evidence as well, and build on what Carrie's doing, but really trying to translate that into community-based programming, which we don't really see in most of the research centers. So we're basically trying to take the research out of the University of Calgary building and say, okay, here we go in Calgary, here's programs for Cardell, Talisman, the Y, Wellspring, and get the best evidence-based safe programs out there so that individuals can actually use them. You don't have to come into one of our exercise programs to access them. And I can tell you right now, I mentioned before, if I said if you're going to do anything, do stretching. Well, we do have a number of sites that run our yoga programs. Now I know as soon as I say yoga, everybody clicks off in their head. But trust me, I know there's a few men that have done the programs. It's a wonderful form of physical activity, and you can do it with your partner, and it's all free. So it's something that spouses, partners can come in with you, so you've got that support for coming to be physically active. And we run them right now. They're in 5 locations. In the fall, they'll be in 7 locations in the city. So they're pretty accessible if you are in Calgary. And as I mentioned before, that website there, we've tried to pull together all of the relevant links and information that's out there from a physical activity perspective. So you can go there and click on the resource link for patients and find all of the other websites and books and whatnot that I've talked about, plus a whole lot more. And as I just mentioned, Wellspring Calgary. How many people are familiar with Wellspring? A few of you. Okay, so for those who don't know, it's a privately funded center for cancer survivors and their support persons, and it offers free programming from all sorts of things, from counseling to peer support, art programs, music programs. And we run a lot of our physical activity programs out of the Wellspring facility. So we run a drop-in program here in Calgary. We run our yoga programs through them as well. And then we've got different tumor groups. We've got a lung program, starting a brain program, different things like that. And we have had our prostate-specific program through there as well. But they're a great resource. So I found this quote from Robert Goulet, which I think sums things up fairly nicely. I'll give you a second to read it. It's not an easy road once you have been diagnosed and you're living with cancer, and I hope that you can use physical activity to make it a part of your everyday life and see the benefits from it. There's a number that you can achieve. Thank you.